So here are likely co-occurring disorders with FASD. Again, these first four here because of the genetic link. So they may have a co-occurring ADHD and FASD. And people always say, well, if they have both, will stimulants help if they need medication? And my response is stimulants may help them filter out stimuli and focus. It's not going to help them remember 3 directions at once. It's not going to help with the FASD piece. If they have schizophrenia, major depression, bipolar disorder, again, the treatment for those needs to be modified. We can't use talk therapy. It's not going to work. We can't use our typical approaches in mental health. It's not going to work. And they may have a co-occurring substance use disorder, and we'll see this a lot in, first of all, the interesting thing is we found that for those with FASD who use substances, their age of first use is much younger than those who don't have FASD. And the average age seems to be, of those we have seen, maybe around 12. So again, earlier substance use might be another indicator. Could this be somebody with FASD? Other likely co-occurring disorders, again, many of them have sensory integration issues. They're like oversensitive to light, sound, temperatures, textures, tastes. Very young kids are seen as picky eaters. Some of them don't develop good enamel on their teeth because of the prenatal exposure. Certain foods like mashed potatoes, peas, ice cream sometimes they don't like, and they're just seen as picky eaters, but it's not that they're just picky eaters. So these sensory issues are really, that hypersensitivity is something to pay attention to. They may have a co-occurring reactive attachment disorder, especially if they've been moved around a lot. But even if they have a co-occurring reactive attachment disorder, the approach to RAD needs to be different. They may have a separation anxiety disorder, especially if they've been moved around a lot. Now, I've heard of people with FASD who have been in 7, 17, or 27 foster homes by the time before they're 18 years old. Because they keep moving around from foster home to foster home to foster home, because we also don't often train foster parents in understanding FASD. And these are very, very difficult kids to parent. They don't eat well. They don't sleep well. They get into trouble with their siblings. They get into trouble in school. They get into trouble at home. They are overwhelming to deal with. And they don't respond to the typical reward and consequence systems. They certainly may experience post-traumatic stress disorder because of the level of abuse that they experience from early on in life. Again, they don't eat well, they don't sleep well. Over 50% of those with FASD have significant sleep disturbances. They can't get asleep, but they don't stay asleep either. So they are at high risk of abuse and trauma as young kids because they don't respond the way others do. And they're also at high risk for abuse and trauma because they don't recognize dangerous people in dangerous situations. This is due to damage in the amygdala of the brain, which is responsible for recognizing fear and knowing what to do. And again, they don't learn from being in a dangerous situation not to be in that situation again, because that area of the brain is damaged. So just don't do it, doesn't work. So they may experience PTSD, but most of our treatment for post-traumatic stress disorder is cognitive behavioral therapy, and it's not going to work unless it's modified. The problem in mental health is that we diagnose people based on what we see, and we treat people based on diagnosis. There's been some talk in the field of psychiatry over the last 15 years or so about the possibility of moving more to a symptom-based treatment system, where we look at what's going on with the individual and then how do we treat that. But we're not there yet. We treat people based on diagnosis. So if you get a youth in your class who's diagnosed with oppositional defiant disorder, we know exactly what we need to do. If you get a youth who's diagnosed with bipolar disorder, we know what we need to do because here's the treatment for bipolar disorder. And we don't really think about, more broadly than that. So if there's a co-occurring FASD with other disorders, we really need to pay attention to that because everything we do needs to be different.